Hello. This video is an introduction to Inspect SR tool, a tool to assess trustworthiness of RCTs in systematic reviews which has been newly released. But first we need to know what trustworthiness stands for. There are multiple definitions of trustworthiness, including the extent to which we can be confident that the research findings are firm. Some authors have suggested that trustworthiness assessment should be seen as akin to the diagnosis of fraud. Trustworthiness has also been discussed as study data being reliable due to the integrity of both the research process and the intentions of those involved. Inspect SR stands for Investigating Problematic Clinical Trials in Systematic Reviews. This tool was developed by researchers at the University of Manchester, Cochrane, and it was developed in conjunction with more than 40 institutions worldwide. It is designed for studies with randomized controlled trial design. It is developed to address the risks posed by untrustworthy RCTs. This tool is designed to be used in conjunction with risk of bias assessment tools, and it is important to mention that Inspect SR does not assess risk of bias, generalizability, or conflict of interest. Therefore, for these domains, separate tools need to be used. The importance of this tool is that problematic studies, defined as studies with serious questions about the trustworthiness of their data or findings, either due to misconduct, including plagiarism, falsification, and fabrication of data or methods, or due to critical errors in study conduct that weren't identified by risk of bias tools, can hurt the results of a systematic review. Inclusion of problematic studies in systematic reviews may result in misleading or even actively harmful treatment recommendations. For the development of Inspect SR, there are two articles available at the moment. The first one being the protocol, which was published in BMJ Open in 2024, and there is also a preprint of the full text of the article, which is not peer-reviewed yet, but it's accessible in medRxiv. This tool is a checklist that contains 4 domains and overall 21 items. The domains of this tool are post-publication notices, study conduct, governance and transparency, text and figures, study results. In the end of each domain, there is an overall domain judgment, and there is an overall study judgment at the end. Each item has 4 responses: yes, no, unclear, or not applicable. Overall domain judgments and overall study judgment have 3 responses: no concerns, some concerns, and serious concerns. To use this tool, it is suggested that 2 reviewers first apply this tool independently and then compare their assessments and reach agreement in relation to any areas of disagreements. It is recommended to apply this tool prior to the risk of bias assessment of the eligible studies due to efficiency purposes, since studies that will receive a serious concern rating are not going to be included in the systematic review, and therefore by doing Inspect SR before risk of bias assessment, we will save energy and time. The checks in each domain are supposed to be used to reach a domain level judgment about trustworthiness. Inspect SR does not use a prescriptive algorithm to produce a domain level judgment from the checks in the domain. And to assist you with reaching judgments for each item and an overall judgment, There is a guidance document which is available at OSF. This document contains instructions on the incorporation of Inspect SR in systematic review steps, decision guidance for each item, decision guidance for the overall judgment, and examples for each item. It is important to keep in mind that the purpose of this tool is to identify potentially problematic studies, but a reviewer may decide they have enough concerns about a study without having completed all of the checks included in the tool. For efficiency, the reviewer could terminate the assessment of a study if they consider a judgment of serious concerns is warranted at any point during the assessment. The reviewer might decide that there are serious concerns related to a specific domain, having completed only a subset of checks in that domain. The cumulative impact of judging some concerns in several domains may be enough to warrant an overall judgment of serious concerns for this study. However, in some cases, these studies may receive an overall judgment of some concerns. The reasons for the domain and study level judgments should be reported for transparency. Inspect SR assessments should be reported in appropriate sections of the systematic review, for instance, in the characteristics of included or excluded studies. Any trial judged to warrant serious concerns should not be included in the systematic review. However, trials receiving a study level judgment of some concerns should not be automatically excluded or left out of the synthesis, but it is rather recommended to perform sensitivity analysis on these studies to determine their influence on the results and conclusions of the review. A judgment of serious concern is intended to be used only when there are features of the study that either alone or in combination cause serious doubts about the trustworthiness of the study, and it should be only used if it is clear beyond reasonable doubt that there are truly serious concerns. Correspondence with the authors of the primary studies may be beneficial in the clarification of the points of uncertainty in relation to the trustworthiness assessment, which is a strategy that it can be used in these situations when there are unclear items. Inspect SR can be accessed from the OSF page of this project, which is available at this address. For further reading, you can refer to the developer's instructions in Cochrane training and the guidance document of Inspect SR, which is available at OSF at the website address below. These are the references that I have used for this presentation. Thank you for your attention. Don't forget to like and subscribe if you like this type of content. Thank you so much.